right. Well, it's always great to be in the villages. I want to thank UF Health. I want to thank Dr. Nelson for having us here. We were here last, I believe, sometime in the middle of July. And fortunately, and they were obviously dealing with some of the increases we were seeing throughout the state. Fortunately, since that time, we've had really positive trends. So, for example, today we can report Florida that the number of COVID positive patients that are currently hospitalized is down nearly 60% statewide from our July peak. And there are certain counties that had significant increases who were down even more than that. The number of COVID positive patients hospitalized in the ICU is down about 52% since the July peak. The number of COVID positive patients across all Florida hospitals represents roughly 6% of all the licensed hospital beds in the state of Florida. The number of hospital admissions for COVID yesterday, and the weekends typically see higher admissions. That was the lowest single day of admissions since the middle of June. Today, Florida's reporting about 1,950 new cases. That's the lowest number since June 14th. Antibody testing at Florida's drive-through sites has continued to register at between 20 and 25% seropositivity, while our diagnostic positive percentage has fallen to the 5 to 6% range. 27% of all hospital beds in Florida are empty, and 24% of all ICU beds are likewise empty, and ED visits for COVID-like illness have returned to levels seen during the first half of June. So those are obviously, it's been a lot of positive movement over the last 4 to 6 weeks, and we want to obviously see that continue. I want to thank Dr. Scott Atlas for coming from the White House Coronavirus Task Force. Throughout the whole pandemic, we've had the president, the vice president, and probably just about every member of the Coronavirus Task Force has come down to Florida at one time or another, and we've gotten a lot of great assistance from the administration. And we just announced a couple days ago, we're going to have over $125 million just for long-term care facilities in the state of Florida to do things like point-of-care testing, to do things like continue to fortify their PPE stockpile, to use in ways that can continue our efforts to protect the most vulnerable among us. So we really appreciate the administration for doing that. And I want to thank Dr. Atlas for coming down. We were in Tallahassee this morning. We're making a stop here, and then we'll be at the University of South Florida later today. We approached this particularly as we got into May and into June. The initial March, April was kind of everyone didn't really know what was going to happen. It was a time of great uncertainty. There were obviously measures taken in various ways across the country, including some here in Florida. But as we got through that initial period, we really took that opportunity to prepare for the future, not knowing kind of what the virus would bring. Our areas of focus were, one, protecting the most vulnerable among us. And that means, of course, those who are elderly in long-term care facilities. We've provided huge amounts of PPE to those facilities. Obviously, we've required wearing that since March. We've not allowed visitation since March, although we are going to address that very soon because that's kind of served its purpose. We do need to get that human interaction again. We've done a lot of testing, not only for residents, but staff, and we test the staff bi-weekly. And we have over 4,000 long-term care facilities in Florida, and over 200,000 people work at those facilities. So we're doing them on a bi-weekly basis, 200,000, which is a lot. And then we were the first state in the country to establish COVID-only long-term care facilities. So that if you have an elderly resident of a long-term care facility who is COVID positive, you have a safe place to transfer them where they can be isolated and not risk spreading it to other members of the facility. And so that's been something. We now have 23 of those facilities across the state. But that, although that is the most vulnerable segment, are seniors in long-term care facilities, and certainly the risk to those seniors is higher than the risk to seniors who are not in long-term care facilities. There's no doubt that as people get older, the risk to COVID-19 increases. And so I think what we've seen here at the villages is working with obviously the folks at the villages, how the hospitals handled it. You have a very large senior contingent, very active community, and they made changes at the very beginning about, okay, let's dial back some of the more risky environments so they don't do the same type of indoor large crowded gatherings like they used to. But I think smartly from the very beginning, they have maintained a lot of activities for their residents here, particularly with respect to outdoor activities like golf. And I remember Gary Lester, we were talking very early, and he's like, we're not going to be allowed to play golf. I'm like, no, you guys need to do that. Because I think what they did from the beginning is they said, okay, we understand the risk, we want to take appropriate action to mitigate the risk, but we want to do that in a way that's sustainable for our residents. And so I think that they've done that, and that's a combination of the community and the individual residents really being committed to that. But I think if you look at the demographics of this community and then compare the COVID outcomes, I think that they have done far better than what I think most people would have predicted, just given the basic realities of the disease. And so my hat's off to folks throughout the villages. My hat's off to the people here at UF Health Villages Hospital, because I think it's I think it's really, really strong story. So protecting the vulnerable has been the top priority. Second, and a close second, is making sure that we support our hospital capacity, our frontline healthcare workers, and we've done that. If you look, the state of Florida has sent tens of millions of pieces of PPE, from face masks to face shields to gloves to gowns. When the hospitals needed more remdesivir, we were able to go and work with the task force and get expedited shipments into the state of Florida. Unfortunately, our hospital traffic had picked up. We needed to expedite that. So we were able to do huge shipments of remdesivir. When there was a need for more convalescent plasma, we went out and asked for blood donations. And in our antibody sites, we encourage people, if they test positive for antibodies, to turn around and give blood. A lot of the emphasis in March was not overwhelming hospitals, and the focus was really a lot on the number of beds. I think what we found in Florida is we had enough beds. That was never going to be an issue. You were potentially going to have stresses on the staff. Part of it is just because it's a very stressful time. Part of it is because some of the staff had to isolate as the community prevalence of the disease increased. That's the staff's a reflection of society. You were going to see more and more of that. So we sent over 2,000 medical personnel across the state, many in South Florida, but also some elsewhere, to be able to buttress those efforts. And I think that was something that was very, very important. We also, because we had these COVID-only nursing facilities, hospital was able to take a resident of a long-term care facility who was COVID positive but medically stable and didn't need additional medical care. They had a safe place to discharge them. We would not allow hospitals to discharge COVID positive patients back into the long-term care facilities from the beginning, because obviously that creates a hazard. But if you have this COVID only unit where you could do that at a facility, then that's something that's obviously safe. So that was something that was important. And then when we came into June, in the middle of June, getting that third week, fourth week, you start to see the prevalence increase. There's a lot of people that were clamoring, saying, "Oh, it's going to be a surge. You got to stop elective procedures at hospitals." And I think there were some areas of the country that may have done that. I think the experience in March and April doing that showed that that's not what you wanted to do. So we did not do that in Florida. We basically told the hospitals, we said, you understand how to manage your patient load. And so if you look at like a Jackson Memorial down in Miami, they were kind of the focal point of the most intense increase in patients. So they dialed back accordingly, made sure they had enough cushion, made sure they had enough staff. And we obviously supplemented that. There were other major health systems that never had to do anything with elective surgeries or elective procedures. And that, I think, has worked so much better. These procedures matter. I mean, the amount of, and Dr. Atlas can talk about this, the amount of missed health care or people who have not gone in when they've needed to certain things is dramatic throughout the country. So we wanted to avoid that. And I think we were able to do that by allowing the elective procedures and stressing to people, if you have problems aside from COVID, this is a safe place to come. If you need to go to the ED for heart or stroke, make sure you're doing that. And then the third thing that we were focused on was just keeping society functioning. The idea that somehow you can just shut everything down, hide, and then it goes away, we know that's not how it works. It's not like a hurricane. You can hunker down, it passes, you come out. So we knew that we had to just keep society functioning. So we did that throughout June, July, and August. Last month, we added 75,000 private sector jobs in the face of, the height of the outbreak. In fact, I think Disney opened right as the infections had peaked. I think a few days before our ED visits peaked. But ever since they've opened, you continue to see a downward trend, which is good. We've kept gyms, beaches, restaurants, hotels, theme parks, youth activities, sports open and operating. And I think that that's important to do. And I think that we understand, I think, a little bit better now the importance of having society function. Part of that is having K through 12 and universities open and available for folks. And so Dr. Atlas and I are going to be going to the University of South Florida after this. Dr. Nelson and everybody at UF, I think, has done a very good job of, you're going to have 50-some thousand students return. Many, I think they're here now. How do you approach that? And I think that they've been very thoughtful about doing it. But having parents have the option to provide in-person instruction if they're K through 12, and then also giving the parents who want remote learning for their child the ability to do that as well. And then certainly having universities functioning. I mean, a university is a much lower risk environment when you have a lot of young, healthy people. When the universities closed with the start in March, at the start of the pandemic, you're taking people in a relatively low risk environment and then spreading them across the country where they're probably in higher risk environments. And so I think people have learned a lot of lessons from that. So our universities are open, they're going to continue to function, and I think that that's really, really important. So it's good to be here. We're going to hear from some folks. I'm going to introduce Dr. Nelson in a minute, and then obviously we have Dr. Atlas here as well. So thanks to the villages for having us. We appreciate how you guys have handled this, and I think you've made a really positive difference in the lives of your residents. So Dr. Nelson?
Thank you. It's always a pleasure to welcome the governor to the villages, especially on behalf of UF Health, and the villages. I'm just going to provide some very brief updates. I wear two hats, or in this case, two masks today. One is I oversee the UF Health delivery system. And so there's fairly good news there. The number of COVID cases in hospitals and ICUs have been steadily decreasing over the last month. We had highs in our Jacksonville campus in the 115, 120 range. Those are now well below 100. Gainesville in the 80s and 90s, those down into the 50s. And here in Central Florida Health, the two hospitals combined, also kind of low 50s. So the health system never came close, as the governor referenced, to reaching capacity in the state of Florida. And we, I think, have the benefit of having seen those ahead of us in New York and elsewhere, learned a lot about how to manage patients. And I think you've seen fairly low death rates in Florida and good and better outpatient care. So from a health system perspective, we feel very confident we're able to continue to meet the needs of this pandemic. For the villages themselves, it's been a fantastic partner. They have come forward with all kinds of innovative strategies to stay active and yet stay safe. We have been very anxious about this community, but they have continued to show us that they're protecting themselves. The leadership here has closed down the movie theaters and other areas at the right times based on medical advice. And so we think it's been a special partnership between UF Health and the villages. And the last comment I'll make is the governor said, so we also have to open up today a university where over 50,000 students showed up in the last 2 weeks. So we have successfully done that. We did it, though, in a progressive series of bringing people back. Last month, we brought back, over the months of June and July, over 30,000 employees and set up ways to screen and test a large majority of those people to make sure the environment was safe. We have offered the same opportunity, 100% screening to all 50,000 students and optional testing with a very, very strict contact and tracing program set up at the university in collaboration with the Department of Health. It was a quiet weekend in Gainesville, which is always a good thing. And right now we've had, as you probably heard, very few cases, only 3 in Alachua County. So again, we think there's some really good news about the University of Florida. It's reopening, and we plan on hopefully keeping the university very active and keeping as many students face-to-face, or at least on campus, as possible. So again, thank you, Governor, for the trip back.
So good afternoon. So I'm Dr. Mike Lazarda. So I direct the University of Florida Health Screen Test and Protect program on campus. Since the very beginning of the pandemic, the University of Florida has been engaged in the communities where we serve. And in fact, in late March, we began our screening program here with the villages. As Dr. Nelson said, the villages have been a fantastic partner for us to be able to reach out to the community. And much of what we learned here, we applied to the other 100,000 people that make up the UF community throughout all 67 counties in Florida. We're using that information, we're using evidence, we're using our contact tracing program that Dr. Nelson referred to gain more information, to understand more of how this pandemic is spreading throughout the community and what we can do to control it. Again, as I tell people on campus, we're not powerless in the face of this pandemic. There's a lot of information that we can use and to garner and to move forward with evidence-based recommendations. And again, focusing on the vulnerable is going to be one of those key steps. So as we learn, as we go through this and partner with everyone, we feel empowered to be able to keep moving forward. But again, there still remain a lot of unknowns, and we'll continue to address those unknowns. And every day that goes by, we learn more and more to try to apply that science to help make a difference as we move forward. So I just want to have a few brief comments here. I have very little to add to Dr. Nelson's very good summary of everything. But again, it's a pleasure to work here with the folks in the villages. And thank you very much for the opportunity for us to serve the community here.
Thank you. I'm Commissioner Richard Corcoran, Commissioner of Education. Just want to again give great updates. Throughout the whole month of August, we've been opening up. The governor was very clear. He wanted to give maximum flexibility to the districts. He wanted to give choice to the parents, and if whatever they chose, that form of education, he wanted available to them, recognizing that the best form of education, without question, is when that teacher is standing in front of that classroom with that child and they're imparting wisdom and knowledge and the kids are interacting, is the absolute best form of education. So the results are all of our districts are open as of today. The last 18 open up today. Face-to-face instruction at all of them. Almost 60% of our parents and students chose face-to-face instruction. 95 to 100%, depending on the district, of our teachers wanted to come back and be there with their students and imparting that wisdom. Perfect example is here in the villages. We have Dr. McDaniel with us from the Village Charter School. 3,400 kids, K through 12. 78% chose face-to-face. The remainder chose distance learning. And it's working. Our kids are getting a great education. Parents are being given a choice in a very thorough, safe environment. And so it's a great final day to announce 1.1 million as of today kids in face-to-face instruction of our 2.8 million children, and it's all going very well. Thank you.
Good afternoon. It's a great honor to be here representing President Trump, Vice President Pence, and the task force, and a great honor to be with Governor DeSantis. It's really quite amazing. The Villages is something, it's a huge success story, and I think it's a model for how other senior frequented facilities are, because as the governor and everyone here knows, while the most vulnerable are those in nursing homes, there are many other seniors to take care of and protect, and this is very much in concert with the president's general strategy here on the coronavirus pandemic, which is number one, protect the highest risk people and save lives by doing so. And number two, making sure we don't have hospital overcrowding, because as Governor DeSantis has known throughout this, you really need to make sure medical care is given to everyone else. It's not true that the only non-essential care, that's not a synonym for things that aren't important. And we know that many people, there's a considerable cost to shutting down medical care, whether it's cancer, chemotherapy, live organ donor transplants, cancer screenings, biopsies, immunizations, all kinds of things went by the wayside in the prolongation of the lockdown, and I think we've learned a tremendous amount about that. And then, of course, the third part of the president's strategy is exactly what Governor DeSantis and everyone in Florida is aware of and is doing, which is making sure that we safely open schools and the economy, because we cannot sacrifice our children. I mean, there's nothing really higher on the national agenda than educating our children, and the harms of not opening schools are really tremendous.